Mission and Margin is the business of healthcare.
I started 3 years ago as director of Consolidated Human Services, which is both social services and the health department, but it was quickly identified that the number one health issue in Carteret County was the opioid epidemic. We were having 39 people die, many of them young. And it was when I interviewed for the job, they told me that, the county being on the coast was very good at preparing for hurricanes, with Emergency Operations Center opening up and bringing in all the partners. And it saddened them that they did such a good job with hurricanes and might, hopefully not lose anybody. And yet we were losing 39 young people a year to opioids, and we couldn't match that kind of response. And the comment was made to me, I remember saying, why can't we do that like we do for hurricanes? Why can't we bring everybody together? To me, the huge difference in the program, to go from 39 deaths, and one death's too many, but to go from 39 deaths 2 years ago to just 4 so far this year, and to cut our overdoses by 90% in 2 years, and to reduce our ER visits by 50% in 2 years. People always ask me, gosh, how did you do that? And I think the two things that I would attribute that to are the peer support, the lived experience, and responding 24/7, engaging. I just heard Brook mention there was this misconception out there that we had heard, well, gosh, even Randall, if you make contact, 50% of the time they refuse to go to the hospital. They won't get in the ambulance. And so everybody says, see, they don't even want help. Well, what Brook has shown is with a 90% engagement rate, it just meant they didn't want to go to the hospital. It didn't mean they didn't want to get housing or treatment or Suboxone or get into Narcotics Anonymous. All that statistic meant was they didn't want to go to the hospital. So we've shown that if you meet them where they are with somebody with lived experience, 90% of them will get to a better place, which has been just astounding to me. It really has.
Watch, listen, or read Business of Healthcare interviews at BOHseries.com.